reparative therapy, it's in the news all the time. Give me your thoughts on it, please, on this really important topic.
Well, one thing is I'm surprised it's in the news all the time now. It's been in my therapy room for decades, and working with clients who, whether under the name of reparative therapy or mainstream psychotherapy, where people's first experiences of gender or sexual minority was being taken to therapy and treated as if this was some kind of pathology, something has gone wrong, which was therapy which actually reinforced the negative message that people received about being different. Unfortunately, I've had a number of clients who, going for mainstream psychotherapy, had installed theories that somebody had abused them, that someone in the family was an abuser, and I've seen tremendous, really quite tragic stories of families split apart by presuming that therapy's the way to go.
How widespread is it, do you think?
I think for people of our generation, Shelley, I think it was the norm. I think that when people first began to think that something was happening, or that they were alone or afraid, or that being in a minority accompanied other difficulties, that many psychotherapists were trained to focus on that as the primary issue. I did some research over the last 3 years. Some of it was with Christian therapists, Muslim therapists. A lot of it was just with some wise old heads who've seen it all and been through it. And many of them said, Pam, I've done it. That was how I was trained. But don't you dare say that to anybody, because the approach that is just about disparaging and shaming a few overt bigots is actually making people feel less confident to come forward and say, I need more training, I need more information, I need a safe space where I can ask stupid questions that maybe I don't know the difference between transgender and being gay. Can I say that? May I ask for that information? And I think that this is a very, very real issue about how do all psychotherapists become better informed, appropriately trained, to receive the vast diversity of clients who come and see them.
You touched on it earlier. Just how damaging do you think this kind of therapy or this approach can be?
Well, I think when we see psychotherapy practiced in an overt reparative therapy context, that person then is possibly already in quite expressed homophobic environment, culture, family. I think that then compounds something which is already existing and echoing in that person's daily life. I think some of the covert assumptions of some psychotherapists who have not questioned those assumptions sometimes can be even more insidious in terms of colluding with a person's internal and internalized homophobia and internalized shame in a way that perhaps is more difficult to spot, and therefore more difficult for the person to develop a psychic immunity to. When I work with people who have gone to religious reparative therapy and they know that's what they went to, it's very defined, and although it's very traumatizing, they can identify at a certain point that this was not appropriate for who they were, or maybe not appropriate for their understanding of Christianity, or when the penny dropped that it was not a choice between sexuality or spirituality, that spirituality embraced sexuality, and that sexuality was in connection to a person's spiritual self. And sometimes I think the ability to identify this teaching is not appropriate for me is easier when the teaching is expressed overtly.
I love your passion. You're clearly very engaged with it. So what would you say to somebody who was struggling with their sexuality perhaps, and what ought to be on offer for your model, let's put it that way if I may, for psychotherapy? In other words, what would somebody get if they came into your therapy room or in the model that you're proposing?
I think one of the key things is that a psychotherapist has to understand how real the conflict is for a person who feels this is a choice between being lonely all my life and not able to speak my personal truth, or being damned to hell, or being rejected by my family, or not being able to enjoy the things that I've seen my brothers and sisters have in terms of marriage, children, job, and how very, very real that pain and that fear is, and how desperate people are for somebody to tell them, yeah, there's a cure. There's a simple thing here. We'll find something in your history that made you this way, and we'll give you something simple to make this conflict go away. And actually psychotherapy has always been about working with those apparent paradoxes and for people to integrate elements of themselves that appear to be dissonant with each other. So I'd like psychotherapists to appreciate the truth of a person's conflict, that they need to be safe, and that in that initial interview with a therapist, their desire for change is real. And rather than chase them away, to give a genuinely informed and compassionate space for that. The other thing I think is that sometimes psychotherapists become very narcissistic, as if they're the only resource for that person.
Right.
And I think being informed and having some websites, some information, some psychoeducation about gender and sexuality, diversity, churches, mosques, synagogues, are things that we can provide for people that are as important as psychotherapy.
And of course, somebody presenting for therapy may well have issues and neuroses that have been caused by the way they've been treated, but that's more the issue rather than the issue of their sexuality or gender identity.
Oh, I would say that is quite common, that people come to psychotherapy to deal with the trauma of first going to psychotherapy. Right. And if you look at, if you go onto YouTube and if you type in Exodus apologises, you'll see the leaders of the Exodus movement now apologising for the damage that was done. And that's very, very moving, and I think very consistent with the Christian message, actually, that we can get it wrong and say sorry. And one of the things I really learned from over the past few years was talking to Christian therapists, and I understand you identify as a Christian.
I do, and I have to be very careful about the terminology, don't we? Because if I call myself a Christian therapist, there's a lot of connotations for people. I prefer to say I'm a psychotherapist who is a Christian. And part of that belief actually is in accepting people. And the notion that people are in some way damned or evil because of either their sexuality or their gender is really quite preposterous when you think of it. You know, God of love presumably wouldn't inflict something that was evil on 25% or 25% of the population. I mean, it just doesn't stack up, does it, if you think of it in those terms. So for me, there was no real conflict about that. And people, I think, all too readily can use religion as a cloak for their bigotry, because the religious arguments don't stack up. We live in a society where people readily break the 10 Commandments. Thou shalt not steal, thou shalt not commit adultery. Somehow we accept that in the 21st century these things happen, and that people are not going to be condemned. And yet we have a pick list of what we want to pull out of Leviticus and Deuteronomy to condemn people because of their sexuality. And I'm really purposely avoiding that word of sexual choice, as if. I mean, the notion that you choose your sex. It's interesting that only gay people have chosen their sexuality, isn't it? And that heterosexual people haven't actually sat down one day and thought, oh, I think I'll be straight.
Mm-hmm.
You know, the notion that you somehow at some age in your development think, oh, I make a choice about whether I'm attracted to men or women, is almost, it beggars belief really, doesn't it, that you could espouse that. But the only justification for calling it a choice is so that you can then condemn people for it.
And also it denies that there is for some people, there is a fluidity. Some people go through life and experience a change, or for example, as a bisexual person, okay, I'm an equal opportunities lover, however I can't choose who I fall in love with.
I love that, equal opportunities lover.
And I fall in love with a person.
Yeah.
And what their gender is seems to be not part of it really, but that isn't a choice who I fall in love with. I'm interested, as you say, that often bigotry is justified, or religion is used to justify bigotry. And some of the arguments that I've heard about why someone who is a Christian should work to not become, or not be gay, or not be transgender, is the argument that, well, God has given you his challenge, and we're all born sinners. We're all born sinners, and we must work to match God's plan for us, and his plan for us is to be heterosexual.
Yeah, I'm not sure that it says that anywhere in the Bible, does it? It's an interesting notion. And I think that's just the point. You can sit down all day and you can have a pick list and you can twist phrases to have it suit your need. And it's a very simple matter for me. I don't believe that a God of love will give somebody something to cope with that would be impossibly difficult. And I think that's the very notion that racks people full of guilt, makes them unhappy with whoever they are, and then as psychotherapists we're called on to get people to accept themselves. The biggest learning curve I ever had was in my early days as a therapist, and I worked with a woman who was absolutely destroyed by the fact that her son had committed suicide at the age of 17 because he was gay, and all he'd heard in his household was that it was evil. And that woman, for the rest of her life, has to deal with that. And that, for me, was a very powerful message. You know, people will kill themselves at the end of the day because they cannot change something, and if you can't change it, then why would you even want to try? And it just doesn't hold water for me to, in fact, the most un-Christian thing you could possibly do is inflict guilt on somebody because of how they were born. I mean, how can you call that any kind of religion, leave alone Christianity? I can't speak for other faiths, but it just does not stack up.